take you through the complications that come as a result of this condition that is called diabetes. Now, diabetes is basically sugar in the system. So these are the complications of sugar in the system, and most of you have at some point experienced such uh, as you lead your daily life. You've seen somebody with stroke, and you don't even know what stroke is, but you've been told that this guy is suffering from stroke. That is a complication of diabetes. You've had a dental problem, so your teeth are messed up and you're always visiting a dentist. You have had several extractions, but it doesn't get better. That is a symptom of diabetes. Okay, you've lost your sight, or you always see blood vision, and you're wondering where is this coming from. That is a symptom of blood sugar, higher blood sugars and higher body sugars, and that is also a complication of diabetes. Now, you've had recurrent yeast infection for the women. You're not on any contraceptive. You're not that obese, but you keep on getting this recurrent yeast infection. You keep on getting sick also, general sickness, because diabetes lowers your immunity. So therefore, that low immunity is another complication of diabetes. Now, heart disease is a complication of diabetes. Kidney failure, and all of you know that if you have a failing kidney, you will have multiple complications. For example, kidneys control blood levels and blood cells production by the bone marrow through a hormone that is called erythropoietin. So if your kidneys are failing, you don't have enough erythropoietin. Therefore, your bone marrow gets it difficult to synthesize red blood cells and even the immune cells, the white blood cells. So you have problems with anemia. You will also have a problem with vitamin D, which will lead you to low immunity because vitamin D plays a very major role in immunity and bone development. So that means you also have osteomalacia and weak and brittle bones, even rickets in children. Now, this vitamin D is activated. The last step of activation of vitamin D happens in the kidneys. Therefore, if you don't have functional kidneys, what do you expect? Low vitamin D or vitamin D deficiency. Now, other complications will include erectile dysfunction for men. So you realize most men who are diabetic have or struggle with an erection. Okay, so it's very difficult for you to erect when you're having diabetes. Some will lose a lot memory, and actually memory loss or Alzheimer's and dementia are actually classified as type 3 diabetes. So we'll talk about that also. Okay, so those are just basically some symptoms. And again, the numbness, the peripheral neuropathy, the amputation, all these are complications of high blood sugars and high body sugars, which is basically known as diabetes.